Ladies and gentlemen, welcome back to the Health and Wellness Spot. And here we try as much as possible to help you understand medical conditions. We try to break them down in a way that any person who has not stepped in a medical class can get to understand. So thank you so much for the subscriptions. We appreciate you so much. We hope that those who have not subscribed to continue subscribing. We also hope that you share our videos so that more people get this information, and I know it's very useful to the entire masses. So kindly help us to share these videos and let's grow together. So this is the Health and Wellness Spot. My name is Dr. Lewis, and today I'm going to take you through chronic kidney disease. Basically, chronic kidney failure. So your kidneys are already failing, okay? And how does this come to happen? That is what we are going to discuss in this video. Now, the functional unit of the kidney is basically the nephron. So those of you who have been in a biology class, you already understand the functions of the kidney depend or entirely rely on the functional part of the kidney that is called the nephron. And this is the structure of the nephron basically. Now, about the structure of the nephron and the kidneys, we'll talk about it some other day. However, today, we'll just talk about chronic kidney failure. Now, there are a million nephrons in one kidney, so you can imagine. So these perform different functions in the kidney, and these functions basically involve filtration of blood through the glomerulus. Then we have tubular secretion and tubular reabsorption of important electrolytes and water. Then we have the rest, that is basically urine getting out through the collecting duct into the urethra. So that is how urine formation happens, that is briefly. Now, once you start destroying these nephrons, then your kidney starts having a problem. So therefore, chronic kidney disease or chronic kidney failure is basically the destruction of these nephrons. And once you start destroying these nephrons, then your kidneys start to progressively die. And once they die, then several things start to happen. Now, we cannot talk about what will happen if we don't know the functions of the kidney. And what are the functions of the kidney? We have a mnemonic that is a wet bed. Okay, so a wet bed are basically a way to remember the functions of your kidneys. So A has to be acid stroke base balance. So the kidney plays a role in acid and base balance. Basically, the kidney is the control organ for your pH. So if your pH goes to acidic, then the kidney reabsorbs bicarbonate ions, and therefore they neutralize that acid, which are the hydrogen ions, to give you a neutral environment or near base environment. If the other way, if it happens the other way around, like the base, the system is highly basic, then the kidney reabsorbs or prevents the excretion of hydrogen ions, and therefore you neutralize the acidic environment and it goes back to normal. Then W is basically water balance, and this happens in conjunction with both sodium, because where sodium goes, water follows. So if the kidney reabsorbs sodium, then water has to follow. So again, if you have a lot of water in the system, maybe edema, the kidney plays a role to excrete that water through urine, and that reinstates the homeostasis. Then E is the electrolyte balance. Now, on electrolyte balance, we have potassium, we have hydrogens, we have phosphates, we have also calcium, and the rest. We even have sodium. So these are the electrolytes that are controlled by the kidney. So the kidney controls basically electrolytes so that you don't have excess in the system or you don't have less in the system. Then we have toxins. So elimination. Now these are protein source, or rather protein metabolites like urea and ammonia, which go through the urine and even uric acid. So toxins elimination is a function of the kidney. So you realize how the kidney is important. If at all the kidney starts to get destroyed, then you maintain these toxins in your system, and that can lead to death. Then we have blood pressure regulation. So BP regulation, that is blood pressure, which basically happens on the RAS system. This system is called renin, angiotensin, aldosterone system. So its function is basically to just raise or lower blood pressure according to need. So if you have high blood pressure, then the kidneys excrete more water, and that is aided by this system, renin, angiotensin, aldosterone system. So once you release that water, then blood volume falls, and then blood pressure falls. The inverse is true. When you have low blood pressure, there are sensors in the kidney that detect a low blood pressure, and therefore the kidneys start to reabsorb sodium and water, and therefore your blood volume goes up and your blood pressure goes up. So that is blood pressure regulation. Then we have EPO, which is called erythropoietin. So this is a hormone that basically controls RBCs, the production of red blood cells. So if you do not have this erythropoietin, then the process of formation of blood cells, basically red blood cells in the bone marrow, will not occur. So if you fail your kidney, then chances of you getting anemia are very high, okay? Good. So some of you will again go to the pharmacy and buy. Once you realize you have anemia, you go to the pharmacy and buy those folic acid tablets. One, they are non-absorbable. Number two, if your anemia is as a result of kidney failure, then you're doing nothing. Why? Because again, those drugs are supposed to be excreted by the kidney through urine. And since your kidney is failing, that means you'll be exposed to side effects of these drugs. So unless you know where your anemia is coming from, do not rush to the pharmacy and buy those drugs that are supposed to help you control your blood levels. Okay, good. Then the last one is basically vitamin D activation. Now, in our previous videos, we talked about, you'll watch a video that contains vitamin D, that talks about vitamin D. So we had the process of synthesis of vitamin D, and we realized that the second stage, or the last stage in activation of vitamin D, is through the kidneys. Okay, so the kidneys activate inactive vitamin D to form an active vitamin D. So if you don't have the kidneys, or you have failing kidneys, then vitamin D will not be active, even though you walk through or in the sunlight. So you will not activate vitamin D. That is a problem, because now you'll start having problems with bones. Now, once you've messed up the nephrons, and then your kidney is failing, what happens is all these functions are altered. And how do you know that these functions are altered, or how do you know you have a kidney problem? Now, clinical manifestation is basically the signs and symptoms. So definitely, if you run tests on these people, you get to understand the chart that I've drawn down here. So what I'm doing down here is just illustrating that, first of all, if you have a kidney problem, you have an increase in urea. Okay, and once you have an increase in urea, because urea is a toxin, so this function of the kidney is altered. Once you alter toxin elimination, then urea, which is one of the toxins, starts going up, and this is a protein toxin. Okay, so protein metabolism is very toxic, so urea level starts to rise up. And remember also in the video when we talk about liver functions, we said that sometimes when you have an increase in urea or ammonia in the system, you will experience a condition that is called hepatic encephalopathy, which basically is high ammonia in blood that gets access to the brain and then gives you symptoms of a mad person. Okay, so you think you're experiencing psychotic conditions, yet you're experiencing an increase in urea in your system, or ammonia. So you'll have an increase in urea because of kidney failure. Then this urea will bring you nausea and vomiting. It will bring you heart failure, because it's very toxic to the heart. Also encephalopathy, the one I just explained. Then an increase in bleeding, because urea affects platelets function, and therefore you will not, if you have a cut, you will bleed all the way to death. So basically that's an increase in urea, and that is a function of toxin elimination. So if you alter the kidneys, then toxin elimination will be a problem, and therefore one of the toxins, that is urea, will start going up. Number two, we'll have an increase in potassium, because potassium is an electrolyte. So you see, you've already altered electrolyte balance. So if you alter electrolyte balance, and therefore you'll start experiencing all these effects of potassium. Now remember, potassium is a very toxic substance to the potassium is a very toxic electrolyte, and therefore in the system it's at very minimal levels. So if you add up to the potassium that is already in the system through altering the kidney function, then that will bring you problems like arrhythmias or dysrhythmias. Basically what we mean by arrhythmias or dysrhythmias is abnormal heart rates or heartbeats. So your heart muscles start to beat abnormally, and that is a condition of the heart. That is a problem. So it requires emergency treatment. So that is potassium, increase in potassium. Then we will have weak bonds. So definitely we said vitamin D. So the function of vitamin D, so you messed up vitamin D activation, and therefore phosphorus and calcium will not be reabsorbed, or will not be reabsorbed into blood, and therefore you'll have weak bonds as a result of vitamin D deficiency. Again, anemia. Now remember EPO, erythropoietin. So here we'll have a problem with EPO, and therefore we'll experience anemia, those dizziness, those white eyes, okay, and that tiredness. You'll experience it, and those are symptoms of anemia. Now, if you have symptoms of anemia, as I said, do not rush to the pharmacy to buy drugs. Okay, first of all, establish the cause of this anemia. Then after that, then you can now treat accordingly. If it's kidney failure, then number one cause of kidney failure is sugar. So definitely you are using too much carbohydrates, and then you'll have to control that. Once you control that, your nephrons start to function, your kidney starts to function, and therefore erythropoietin hormone starts to be produced because it's produced in the kidneys. Once it's produced, then anemia disappears. Okay? Then we have, of course, hydrogen ion as a result of acid base, because here we are talking about hydrogen ion and bicarbonate ions. Okay? So hydrogen ions is a function of acid base balance and also electrolyte balance. So if you alter the kidney, then you alter these two functions, then you'll have an increase in hydrogen ions, and this will take you to acidosis. Okay? That is a problem. Now, the next one has to be an increase in sodium and water. Now, an increase in sodium and water, this means you cannot excrete water, you cannot excrete sodium ions. And this is salt. Sodium is basically salt, and salt is sodium chloride. So sodium is part of salt. Now, this means you cannot excrete salt. And if you cannot excrete salt, then you cannot excrete water. And what happens? Edema. And that's why people who have kidney problems, they experience swollen feet and the round face, the swollen face, as a result of retention of water. They also experience problems with the lungs because of reservation or retaining water in the lungs. So they'll have problems in breathing, okay? And that is a result of sodium and water balance. So basically that is water balance and electrolyte balance. Okay, then the last one has to be increase in blood pressure. Now, the kidney controls blood pressure. We already mentioned here, kidneys' function is to control blood pressure. So if you alter the kidneys, then you'll have this uncontrolled blood pressure. And this is because of, again, reabsorption or you do not excrete sodium and water follows. So a high blood volume, which causes an increase in blood pressure. Again, in the kidney, we have a system that is called the RAS, renin, angiotensin, aldosterone system. The function of this system is basically to control your blood pressure. So when your blood pressure is low, the kidney will secrete renin. And this renin is the one that is involved in this system. It will now cause vasoconstriction. It's an entire pathway, it's an entire channel to getting vasoconstriction. So your blood vessels get to constrict so that your blood pressure goes up. And also sodium and water get to be reabsorbed. So it's an entire channel. One day talk about it so that you can get to understand. And here is where misconceptions come in, because this increase in blood pressure is not as a result of salt. It's as a result of sugar. Why am I saying it's a result of sugar? Because sugar is the number one killer of the kidneys. Once you kill the kidneys, you cannot excrete salt, and therefore your blood pressure will go up. Now, this brings me to the point where I need to clear some misconceptions. Misconception number one, you've heard that salt causes an increase in blood pressure. Rather, you've heard that salt causes blood pressure. And people who have been diagnosed with hypertension are told not to take salt. Now, what is the reason? The reason is because salt is presumed to cause you blood pressure. Okay? Now, look at it this way. Salt is never the problem in blood pressure. Sugar is the problem in blood pressure. Why am I saying that? Salt is excreted through the kidneys. Okay? And now these kidneys are altered by sugar, because number one cause of diabetes or kidney failure, number one cause of kidney failure is diabetes. And therefore, if you have diabetes, you kill your kidneys. Once you kill your kidneys, you cannot excrete salt. So you cannot excrete sodium ions and water. And that causes an increase in blood pressure. So the problem here is, if you drop the sodium or the salt, basically, if you drop the salt and you still consume the sugar through fruits, through honey, and others, and simple carbohydrates and processed foods, you will still have uncontrolled blood pressure. Now, if you drop sugar and you keep eating your salt, you will not experience an increase in blood pressure, because your kidneys will go back to functioning, and therefore the kidneys will excrete salt in urine. Therefore, you'll not have a problem with blood pressure as a result of high blood pressure as a result of salt. And that's why I tell you, eat your salt, because salt plays an important role in heart functions, nerve functions, and also it causes softening of hardened blood vessels, and that will help the blood vessels become flexible, and that will mean the blood pressure will start to fall. So salt is very important in people who have hypertension. However, it is the crystal that has been highly demonized to favor sugar. Okay, so this is the entire way of working this out. So salt will never cause hypertension. Salt is only dangerous when your kidneys are failing, because if you take salt and you don't have functional kidneys, you will not excrete this salt through urine, and that means you will have an increase in blood pressure. And therefore, the best way to advise a patient is to tell them to quit sugar. Once you quit sugar in all forms, simple carbohydrates basically, then your kidneys go back to functioning, and salt will be excreted in a way that is needed, and therefore you will not have an increase in blood pressure. So again, mark it. Salt has never been a problem in blood pressure. Sugar is the problem, because it's the one that causes a failure in the kidneys. Number two, whether raw or cooked salt, salt is salt. Salt is sodium chloride. So I don't know where this misconception comes in, that cooked salt is better than raw salt. Salt is salt, and it's sodium chloride. Whether cooked or not cooked, it is still sodium chloride. So eat your salt. It will help you in these conditions, and walk away of this misconception that cooked salt is better than raw salt. They are the same. So basically, that is chronic kidney disease.